All right, good morning Queensland, and a big hello to our Facebook followers out there as well. Welcome to you as well. Can I start by saying that we have some good news today? So we have 6 new cases, 5 are from overseas and detected in hotel quarantine, and we have 1 community case, and this person is connected to the Alpha cluster. She is a close contact of the man that we reported yesterday from Cinnamon Park, and she lives at Kangaroo Point. So Dr Young will go into some more detail there, and she's in home quarantine at the moment. So we have 49 active cases, and in some more good news, we had 22,218 tests yesterday, so fantastic. Thank you again, Queensland, for coming out and getting tested. And remember, if you have any symptoms whatsoever, please come and get tested. We've had 12,617 vaccines delivered yesterday by Queensland Health, and we've done over 1.59 total vaccines that have been delivered in Queensland, so that's excellent news. So, again, we need to make sure that people are wearing their masks in those designated southeast LGAs plus Townsville. Remember, use your check-in app. And, of course, if you are sick, stay at home and get tested. Now, the Deputy Commissioner will also talk today about an update on another hotel quarantine escapee. The person went to extraordinary lengths to scale balconies to get out, but I'll let the Deputy Commissioner update everyone about that. So, once again, great news today. Thank you, Queensland, for the wonderful work that you're doing. And as I said, if we are all doing the right thing, we'll all get through this together. So I'll hand over to Dr Young.
Thank you, Premier. So 1 new community-acquired case yesterday. So this is a close contact of the gentleman I announced yesterday who lives in Cinnamon Park, who was a close contact of the gentleman who went up to Monday. So she was picked up and went into quarantine yesterday and then was tested and was found to be positive. She is perfectly well, so asymptomatic, which means that we can't identify the start of her infectious period. So we've gone back to when she first had contact with the man who lives in Cinnamon Park. So that's the 26th of June. But I think it's unlikely that she was infectious back then, but to be absolutely sure, we've gone back that far. Now, she is a student nurse. She does her training through Griffith University. They've been on holidays since the 15th of June, and we're just confirming, but we believe she hadn't been on campus since that time. She does her clinical placement at Logan Hospital. She hasn't been there doing a clinical placement since the 15th of June, but she did visit for 1 hour to talk to a patient on the 28th of June. At that stage, there was already a mask requirement in for all hospitals in those 11 LGAs, and they've checked and everyone was wearing masks, and they've already tested that person that she spent 1 hour with, and they've tested negative 7 days on. So I'm quite comfortable there. We're just working through whether there's any other venues of concern, but remember we were in lockdown for 4 days for most of that time frame, so I'm not particularly concerned, but we will go and double check. If she develops any symptoms going forward, that will help us determine the actual infectious period. So I apologise, that's a very complicated story. I'm just trying to point out that this is our 1 community-acquired case, and I believe it is low risk, but we have, as always, of course, taking it very, very seriously and looking at all potential exposure sites. So thank you to every person who came out and got tested yesterday. We're seeing really high testing numbers, and that's the best thing we can do going forward, so we find any cases as quickly as possible and then can isolate people. I'll just check my numbers so I don't get it wrong. So we're now at 6,664 contacts related to all of our outbreaks that we've had over the last few weeks, with 5,177 people in home quarantine and over 3,000 in our hotels. So we've got a lot of people doing a lot of hard work in terms of all of those contacts, and thank you to all of the people who are adhering to those requirements to be in home quarantine and to continue to get tested when they're asked to by public health people. Thank you.
Well, thank you to Queenslanders for continuing to come out and get tested. Not only did we do over 22,000 tests yesterday, we have now done over 3 million COVID tests in Queensland since the start of the pandemic. So thank you again to all of the health workers, all of those pathologists in public and private who have worked tirelessly over the last 18 months in relation to those tests. And I continue to ask Queenslanders and those visiting Queensland, if you have any symptoms whatsoever, please come out and get tested as we go forward. And of course, social distancing, hygiene and also the masks. Now, yesterday we said that we had almost 230,000 people booked in for vaccines already over the next 3 months through state vaccination clinics, and that we will be opening up bookings for the around 140,000 people who have registered an interest. Those bookings will be for October on, based on vaccine supplies. Now, I know the Commonwealth Health Minister, Greg Hunt, yesterday said that Queensland will be getting an extra 200,000 vaccines for July, and I just want to explain what that 200,000 is. We will be getting 64,350 Pfizer vaccines per week each week of July. That's the state allocation for our clinics. This is 10,000 extra compared to what we were getting each week in June. So for July, the state-run clinics will be getting an extra 40,000. The GPs will be getting 168,480. So it is correct that for the whole of Queensland, there'll be over 200,000 extra Pfizer vaccines coming into the state, 40,000 for the state-run clinics, and that 40,000 includes that we are required to do the vaccinations for aged care and disability workers, and the remainder is for GPs. So yes, people can start looking at where there is a GP to book for a Pfizer or an AstraZeneca vaccine throughout July, or they can continue to look at booking in with a state-run clinic into the future, and we encourage people to do that, and we will contact everyone who's already registered to let them know when bookings are available.
Thanks, Premier. Good morning. In the last 24 hours, we handed out 116 masks in those areas that still have those restrictions. So the reminder is there for people: please carry your mask and wear them when you should. We did have to issue 2 fines, both in West End and the Fortitude Valley, for people who, given the opportunity, refused to wear masks. So we're still seeing that. At our borders, 2,385 vehicles intercepted, only 3 turned around, and our domestic air borders, 1,450 people processed, none turned around, 14 into quarantine. We saw 162 international arrivals, including 103 persons from within the cap. And as Dr Young said, that brings our total hotel quarantine in Queensland of 3,201 persons, 2,422 of those being international arrivals. Of those 5,177 persons in home quarantine, a reminder to all of them, we do random checks for people in home quarantine. In the last couple of weeks, we've done 1,200 of those, and by and large, the compliance has been very good. But it is a reminder to people in home quarantine that you are not permitted to leave unless there is for very, very few specific reasons. As the Premier said, we are currently investigating and are taking action in relation to a breach of hotel quarantine in Cairns. So a female, 32-year-old female who had come from Sydney on the 1st of July, was placed in hotel quarantine in Cairns, was found to be missing yesterday. Our reconstruction of that, and that includes examining CCTV, it appears that this person has scaled 2 balconies, gone down an outside staircase, and then has damaged a door to escape. Upon being discovered, police have conducted inquiries, and that person was located last night in Cairns, was cooperative with police, but has been returned into custody and is currently in custody at the Cairns City Watch House and is facing a number of charges, including criminal charges. That matter is still not yet concluded. Thank you.
How long was she out for?
So we understand that's yet to be confirmed through the examination of the CCTV, but she was last spoken to on the evening of the 4th and discovered missing yesterday afternoon.
What hotel was she at?
Cairns International. Cairns Pacific International.
And where was she found lacking in Kibla?
She was located at her mother's place at a residence in Cairns.
And so she'll quarantine in the watch house?
Yeah, so that's part of the arrangement, so she'll be quarantined. And I should mention too that on her first test in quarantine she was negative, and we're awaiting the outcome of the secondary tests.
Didn't someone else recently at that hotel try and get out as well and fell and injured themselves?
Yeah, we've had a number of people attempt in the past. This is the first person that actually has got out from up in that hotel.
And how did she damage the door?
We believe she's kicked it in. So she's fairly motivated.
Do we know what day of quarantine she was on? Like, was she...
So she came in on the 1st of July, so day 4 or 5, around there. Thank you.
Well, good morning everyone, including everyone watching online and live this morning. The Australian Bureau of Statistic data released yesterday demonstrates yet again that Queensland is leading Australia's economic recovery from COVID-19. Retail sales growth for the month of May was up 1.6% in Queensland. That was the strongest in the nation, and that comes, of course, off the back of growth in jobs, the greatest growth of jobs in the nation, and also the highest interstate migration in the nation. And that just shows that confidence continues to grow in Queensland. Confidence to invest, confidence to create jobs, but also confidence to spend. And that's a really important thing as our state recovers from COVID-19. And the greatest boost to our confidence is just within our grasp. We just can't look to the short and medium term. We need to look over the horizon to the longer term as well. And that opportunity to continue Queensland's acceleration out of and through COVID is the 2032 Paralympic and Olympic Games. This is an unprecedented opportunity for Queensland. The boost to infrastructure, the opportunity to showcase our state to the world as a destination for a holiday, but also as a destination for investment. Those sorts of things cannot be underestimated. We can see the finish line, but we're not there yet, and we just can't afford to stumble at the last hurdle, which is exactly why Queensland needs to be represented at the meeting of the International Olympic Committee in Tokyo in July. The President of the Australian Olympic Committee, John Coates, has made it clear it's absolutely imperative that our state be represented. And those people who don't want us represented simply don't understand what's at risk for our state. This pathway to future investment, this growing confidence in our state that can continue to accelerate, and the jobs and the opportunities that will come from hosting the biggest event in the world right here in our home state.
Treasurer, why didn't you provide any support to small business during last week's lockdown?
Well, we've adopted what everyone else has done. We've adopted the 7-day guideline, the 7-day rule for supporting businesses. And of course, short, sharp lockdowns work. We've demonstrated that previously. We're seeing strong economic activity in Queensland, and we've seen a strong rebound after short, sharp lockdowns. That's the most effective way we can support business, to get them open and operating again, to get them doing what they do well and best, trading, and that's what we've targeted and focused on as a state.
Some Brisbane bars have started to put on a door fee. They said they have to do that because it's been so tough for them with all the snap lockdowns. What sort of support are they going to have?
Beg your pardon?
Are they going to have any sort of support? Financial support on that?
I know we've made it clear, 7-day rule, that's what National Cabinet agreed, and that's what we've adopted in Queensland.
Even a short, sharp lockdown, though, can cost businesses tens of thousands of dollars. Isn't a 7-day rule just totally arbitrary?
I know it's what National Cabinet's agreed.
That other state have compensation packages for lockdown.
For longer periods. What we want to avoid is exactly what's happening in New South Wales. What we want to avoid is a 14-day lockdown, and I think not just everyone in New South Wales, but the rest of the country is holding its breath to see if New South Wales is going to come out of it in 14 days. We see some disregard of public health orders and public health directions in New South Wales, mask wearing not being obeyed, people attending venues when they shouldn't be. That's putting all of our economies at risk. But what we saw out of our lockdowns in January and March was a strong rebound in economic activity, in retail trade, and that continues to grow. And the ABS data released yesterday shows that businesses are operating at a level 13.5%, 13.5% higher than pre-COVID levels in May. So we are getting the benefit of short, sharp lockdowns, and that's good for the economy.
The lockdown only lasted for 4 days, but the effects on businesses like bars and nightclubs, where they still have to have masks, people sitting down, no dancing, those sort of effects linger on for weeks. Do you think any sort of targeted packages for those types of businesses, or is it completely ruled out?
We, of course, monitor what's going on. We know after the January lockdown, spending bounced back by 10% in the week following the 3-day January lockdown. That's Treasury analysis. Similarly, in March, retail sales are up 0.3% for the month of March, and of course that was better than most of the nation. So we'll continue to monitor that and support businesses as we can.
Sort of specific figures on how these lockdowns are affecting bars, nightclubs, restaurants?
No, not at the moment. It's just, of course, we've just come out of lockdown, so we don't have any specific data at the moment. But we'll look at more data going forward, including the ABS statistics as they come out for June.
With the large number of contact tracing exposure venues, are contact tracers struggling to keep up with the large list and the number of close contacts?
No, because people are doing absolutely the right thing. So I thank every single person who's checking our website and then going in through the portal and giving that information to the contact tracers. So the community helps us, and by the community helping us, we can manage all of this. So thank you.
Any idea of how many contact tracers you've had working?
I don't have that number. It's an enormous number. Yeah.
And just on the AFL for Saturday, a question. Apparently the Lions have been told they have to go to the Gold Coast first and travelling back from Victoria. Do you know what's happening with their arrangements with the Lions?
I don't know, but we don't have restrictions in place for Victoria, so there must be some other issue there.
Premier, can I just get your response to the petition launched online seeking to...
Yeah, sure. Yep. Look, as I said the other day very clearly, if we're in a situation where we're in a lockdown, I won't be able to attend. But the delegation is the Federal Sports Minister, the Premier and the Lord Mayor. And it has been made very clear by John Coates that it would be a disaster if the head of Queensland did not go. And, you know, it's basically to go there, to make the pitch and to come back and then spend 14 days in hotel quarantine. And I think it's very important that we have that really strong representation of federal, state and local, because even Thomas Bach, the head of the Olympic Committee, has said the strongest thing going for our bid is the enormous cooperation of all three levels of government. And just over 2 weeks' time, we are going to learn whether or not Queensland, Brisbane will be awarded the 2032 Olympics.
When do you plan to leave and come back? What date do you plan to leave and come back?
I can get those for you.
How does the staff be connected to that delegation? I mean, media advisors?
No, it's only I think it's one per person who's travelling, so the total composition is 6.
Can you see why people are frustrated though? Stranded Aussies overseas, they can't come home, and you said every day that our hotel quarantine system is bursting at the seams, but then you'll take up a spot in hotel quarantine.
No, because what I've said clearly is that people should be fully vaccinated leaving, and I think people should be vaccinated coming back. Also, National Cabinet, the entire National Cabinet agreed to the lowering of the caps, because look what we saw today. 5 people coming into a hotel quarantine are testing positive, and the Delta strain is very prevalent across the world. So that's why I'm really pushing for this being fully vaccinated going and being fully vaccinated coming back. And in relation to hotel quarantine, we've got South Australia that's going to do that trial at the moment about people being fully vaccinated and only having to spend, I think, and going into home quarantine. So, but that trial hasn't happened yet.
Can we expect 24 hour vaccination hubs around October? How would that work? Are we looking at maybe convention centres, or would that be impossible to have
Look, I'm really excited for the end of the year, and I think Australians should have great hope and optimism that when we get that big supply in, that we want to see as many Queenslanders vaccinated as possible. So, you know, I think we'll move heaven and earth to make sure that we pull out all stops to do everything we possibly can to work cooperatively with the federal government to ensure that we get as many Australians vaccinated. And the sooner we get the population vaccinated, the sooner we can open even more things up.
No specific plans for that in place?
We're always looking at different convention centres. Our hubs are working really well at the moment, and like the Health Minister said yesterday, we're doing around over 90,000 vaccines per week, so the capacity is already there, and of course we can scale up.
Do you know anything about currently in Gympie, the hub's being delayed there? Do you know anything about
No, I'll find out for you.
And just on Tokyo, do you care about this petition? I mean,
Look, people are entitled to their views. I understand their views, but this is the biggest opportunity that Queensland's ever seen. This is a once-in-a-lifetime opportunity to have the 2032 Olympics here in Queensland. We're never going to get that opportunity again, and I'd hate to see it fall at the final hurdle.
Premier, the check-in becomes mandatory for most venues from Friday.
Sorry, can you say that again?
The check-in Queensland.
Yes, that's right. Yeah, mandatory from Friday. Yep.
How and when are you going to fix the issue of police access through search warrants and things, given that it promised that it wasn't going to be used for anything other than contact tracing with road?
My understanding is just used for contact tracing. Yeah, I'll get the Health Minister. Okay.
Thank you. I understand this was an issue in Western Australia, and we've had discussions with the QPS, so the Attorney General's Office and the Queensland Police Service and my department have been talking about this issue. I understand that the QPS have issued a directive now that this data will not be used for this purpose, and there is opportunities, if need be, for us to legislate to make that absolutely clear in law.
Don't you think it does need to be legislated again?
Well, we have that opportunity, but the police have already put in place a direction to not access that data, but we have the ability in legislation to make that clear.
But there was a directive not to use it, and we did at a public last month. There was a direction from the government that it wouldn't be used.
Well, I'd leave it to QPS as to whether it's recently been used, but I was advised last week that they will not be accessing this data. That's not what this data is set for. It's for public health reasons only. I might get the Deputy Commissioner to comment on that as well.
So it has been accessed once in Queensland only. It was not in accordance with what we believed it should be accessed for, even though it was done under a search warrant, so it was a legal instrument that was obtained. What we've done is the Commissioner can give lawful instructions. She's issued instructions that it's not to be accessed, except in very, very exceptional circumstances, and we're talking about terrorism events and things of that like, so I think linked cafe type thing, and even then only with approval of the Commissioner or a Deputy Commissioner, and then subject to legal constraints around that. So that instruction's in place, and just to make sure that it actually works, DHBW, who administer and control that data, will not release the information without that very high level approval. So that's where it stands. So, look, we're absolutely concerned because the whole point of check-in data is so we can do proper contact tracing. That's what that data is for, and we want people to have confidence that's what it will be used for. So at this stage, of course, we work in the rule of law in this state. It's being applied appropriately, and a very strict instruction around what can be done and what can't be done. I'm very happy for if that's what the government thinks needs to happen. That's what should happen. Sorry.
When was it accessed by police?
It was once. I don't know the exact date, Lydia. It was in the last a couple of weeks ago, 3 weeks ago, something like that.
Deputy Commissioner, just on the moment who escaped from the
Sure.
hotel, did she give any reason why? What was her reason?
She wanted to go home to her mother. So, look, quarantine can be very difficult for some people, particularly if they're by themselves. We understand that. Nonetheless, it is a very strict control, and the whole point of quarantine, whether it's home or hotel quarantine, is not to mix with the community. And this person, in order to get out, has committed some other offences, unfortunately. Thank you.
Can I just ask about compliance with the mandatory check-in coming in? How are you going about that?
Sure. As we have done all along, where we have mandated the check-in app, is we have a number of compliance officers. Of course, police, we have Officer of Liquor and Gaming and other compliance officers that have been working in relation to compliance of the public health directives. So businesses should expect, and I know there's businesses right around Queensland, including my local area, who have said that they've had random drop-ins by particularly Liquor and Gaming, seeing if they've got the right signage and everything else for check-in apps in the past, that businesses should expect that they may very well get a random visit, and making sure that they're complying. This isn't about using a stick, this is about a carrot. This is about, if you want the economy to be open, you want people to be visiting your business, then we need everyone doing their part. Individuals, we all have a responsibility when we walk into a business, a cafe, a restaurant, even when we're getting takeaway. We're standing around waiting for to collect that takeaway. It takes 1 to 2 seconds. You just scan, and that means that our contact tracers can contact you if you've been exposed by a positive case. So this is about keeping us all safe, and businesses, again, your customers want it. Customers like using this app. It's far easier and quicker than many of the apps that were being used over the last few months, and they want that security. Your customers want to feel safe, and they know seeing that app there and using it can keep them safe. So we ask everyone to do that.
Sorry, just a question on the vaccines. I want to get to the bottom of the numbers.
Sure.
Because the federal government's vaccination horizon, so Queensland will get 66,820 to 77,000 Pfizer doses each week.
Yeah.
Ellie, you said 64,000.
Yes.
What's that?
Okay, so the Horizon document on the public website is approximate numbers. We also get internally sent by the Commonwealth, every state gets a breakdown of what their allocation is every week of Pfizer and AstraZeneca across every jurisdiction. We have got our allocation for July. We don't have our allocation given to us for August as yet, other than what's on the Public Horizon document. But I can tell you the official document sent by the Commonwealth to Queensland, and it says Pfizer, including aged care and disability workforce, that we were getting 54,990 each week during June, and that goes to 64,350 each week in July. That is our allocation, and the remainder of the vaccine that the Commonwealth Health Minister is talking about for Pfizer will be going to GPs.
And how many do we have in our stockpile now in Queensland?
As of yesterday, we had about 8 days supply. As I said, we wrote 2 days ago to the Lieutenant General to ask for some of our August stock to be brought forward. If we have that stock brought forward, we will still, by the end of August, get down to about 1 day's supply. So it's going to be tight, but we are confident that we can honour every booking that we've got in our system and make sure we've got enough stock for all of those frontline workers and everyone's second dose. And as we said yesterday, those who are wanting to book in, we ask that be patient. They'll be contacted, invited to book in from October.
How many doses are in 1 day's supply?
So approximately about 18,000. My projections, our modelling for the end of August is we'll get down to about 18,000 that will carry over to the next day. We're doing around anywhere between 14 to 19,000 a day, and as we heard yesterday, we're really averaging, I suspect we'll get up to 95,000 vaccines. We planned for 80 to 100,000 vaccines a week. That's what we planned for back in February. We're now doing 92 to 97,000 a week. So we know we're only getting 64,350 a week, and we're doing over 90. We're still about 30,000 short. So that's why we're hoping the Commonwealth will agree to give us some of our August supply early.
Just Dr. Young, there's a pregnant
Last one, really.
on the Gold Coast. I've seen this story, Cassandra Bosch. She's in the Gold Coast University Hospital and she's pregnant. She's has a 4-year-old daughter. And she's saying that hospital staff haven't come in to check on her and her pregnancy, and her 4-year-old daughter will have to do another 14 days of quarantine again because she's a close contact. Do you know anything about that case?
I can just give you general information and I can go and investigate the specific. But of course we allow children to go into hospital with a parent who's a positive case if they've got no alternative. and that's what they want to happen. But it means, of course, then that child has been in contact with a positive case and will have to quarantine for 14 days after that case is no longer positive. So we do have to work that out each time, and that's happened fairly frequently since the start of the pandemic. So that's absolutely the case, but let me go and find out the specifics.
But doctors should still be able to go in and check on her.
Oh, of course, yes, doctors will go in, of course, continuously and check. Yes, there's no issue there.
Go.